What's up, everyone? This is Dr. Charlie Johnson, physical therapist. Hope you're doing well, and I appreciate you checking out the channel and/or wherever you're watching this from. Appreciate you checking out the video. I'm here with Mike, Mike is and sort of was. We never take away access to the content and/or access to me as a coach. A member of the Glute Relief Accelerator program, where basically my goal and my passion is teaching people like Mike and potentially people like you how to resolve their back, butt, sciatica problems using the power of mind and movement kind of combined, and we sort of melt these two approaches together. So I just am so grateful to have you here, Mike, as you kind of share a little bit about your story to maybe inspire other people who are maybe dealing with similar things. So thanks so much for doing this, man.
Yep, no problem.
Cool, cool. And by the way, like, where are you located again? You're pretty close. So I have people that reach out, from all over the world, but where are you at? You're not too far from me, I don't think.
Yeah, I'm in Central PA. I moved recently from Philly out to like the Gettysburg area.
Cool, man. I'm in southeastern PA, like
Yeah.
Royersford, Collegeville. Yeah, we're not far. That's right. Cool, man. So let's do this. If you can kind of share, like, first things first, like, where were you dealing with pain at the time of calling me? Kind of like, what were you struggling with there? Just give me like location of where you hurt and kind of like a brief descriptor of what you were, what inspired you to connect and reach out initially.
Yeah, so I was having low back pain. Sciatica was pretty bad. I could barely walk that much. I remember I was golfing out with the nieces and nephews, like mini golf, and I couldn't walk that well.
Yep.
I've been through a ton of stuff throughout the years, like physical, therapy, chiropractic care. I've been to everything, right? I've tried all the contraptions,
Yep.
everything I found online. I have a drawer full of stuff that just sits at home.
When you open the closet, do the pillows and the balls and everything, does everything fall out?
No, yes. So I was having some of those issues, but I had realized that some of that was mental. So I remember when I first started talking to you, and I think that's what drew me to your practice, was I knew that it was a mind-body connection for me. Mm-hmm. And I don't, I'm not discounting anyone's problems and saying that they don't have back problems, because the pain is real.
Yep.
So that's how it started. So I knew I was already onto something before I found you online, and that pretty much completed it.
Cool, man. And so you had pain, like, in the back, and you had some stuff, weird, funky stuff in the legs too, right?
Yeah, I had twitching in my legs, and it went from my calves up to random parts of my body. I still do twitch.
Yep.
That hasn't disappeared. I mean, there's times where it's worse, and there's times where it's better. It always seems to be worse during stressful periods.
Mm-hmm. Got it. Okay. Yeah. So kind of like this back, and maybe we'll call it sciatica stuff, but mostly back stuff. Because you saw a lot of people, what were you told was like wrong with you? Like, were you given any labels like, hey man, this is your problem. You've got this problem or this problem. Like, can you share a couple different kind of maybe explanations for why you hurt that you were given?
Yeah. So I remember my first visit to a chiropractor, like with these symptoms I was having near my old house. And we went in and we did the x-rays, and I had an MRI done. And when I got the results back, it was like, he's showing me like, hey, you have a bulging disc here, and you have, these other abnormalities. And, I'm 46, but at the time it was probably like, I was like 42 or 43. And he was showing me the x-rays on the wall. And I looked over at a chart, and my back looked to be like somebody who was 43 years old. Yeah. And I said, all right, well, where's my back any different? And he said, well, it's really not. He said, well, you do have a bulging disc. And so I got put on a machine for like 3 months where I was laying down, and he was like stretching, pulling my legs away from my spine. It was like this kind of weird machine that, was on some supplements and stuff. So you can kind of see anything I was willing to try, but it started there. And I think mentally I got some relief, because I felt like I was, something was happening.
Yep.
The pain seemed to cease for a while. Stopped seeing him. And then I had a life event happen a couple years back where my wife almost died and my dog died.
Wow, man.
That's where the pain became significant again. But I got labeled with, to what your point is, I got labeled sciatica. They labeled me also with some other things that I don't specifically remember, but it was nothing abnormal for my age at the time, which he didn't tell me out of the gate.
Yeah. But you were outsmarting him. You were too smart.
But I got too much time to research. Yeah.
Yeah. So you did a lot of your own research, right? And you realized, hey man, these x-rays, MRIs, like that's what a lot of people go for because they want to try to figure it out. But there's a lot of people who are 43, 46, whatever, right? Who have these things and maybe don't hurt. So then like, I'm looking at that. I mean, it doesn't look perfect, but who's to say that isn't the same as somebody else my age and who doesn't feel anything, correct?
Yeah. And I think that that label helps mentally. It's like, all right, they figured out what I have, right? Like you can rest a little bit easier. Like it seems normal, but the label actually helped me like mentally.
Yeah.
But yeah, like I said, it wasn't really much different
Yeah.
than anyone else. And to your point, like there's a lot of people that I've been just reading some books, and the book showed a ton of like evidence around, people that had the same spinal structures in the mid age that weren't having any problems, but that
Yep.
the same structure existed in the X-rays, which
Yep.
was interesting. Yeah.
Totally. Okay, cool. And so yeah, you just said something interesting, right? Where you said, "Hey, the label gave me like it put me at ease a little bit, right? It gave me some justification almost, or something like that." Like, so what are your thoughts on that now? So it helped you in the moment. Did it really help you long term, or was that just like, I don't know, like what happened psychologically there when you were told like, "Hey, this is what's wrong"?
I felt better because I felt, as a lot of people think that especially myself who was a hypochondriac, like you think it's the end of the world no matter what
Yep.
you have. So the fact that, I felt like first I thought it was a tumor and they MRI ruled that out.
Yep.
But I think that label of the sciatica or the pain with the lower back and the abnormalities were actually helped me feel like, all right, you're not much different than anyone else. So the
Totally.
label actually helped me rest and find some solitude and not continuously. And I ended up searching the internet anyway. I
Yeah.
mean, in the long run, it didn't help me.
Yeah.
It actually may have hurt me in the long run, if I want to be honest with
Yeah.
you.
Yeah.
I was willing to say, hey, I have this sciatica pain that, and basically there's nothing you can do about it. So I'm just going to continue to be in pain. So
Yep.
it actually hurt me in the end.
Yep. Yeah, well, okay, and the reason I wanted to highlight that is because there are lots of people like you, right? And I get it, right? And so it's like, okay, I've got this problem. I feel like maybe I'm going crazy here, like, something wrong with me, like there's something special or unique about this. And so how can I figure this out, right? If I just knew what it was, then I'd feel better, right? And so here's the thing. You get one label, and then you get two labels, and then you start to read into it and you're like, well, that label, like that may not actually be what's causing my pain. So like it's this false sense of security almost, right? In knowing, or at least believing like, all right, this is the thing. But then it often leads people down like this endless path, which doesn't result in a whole lot, right? And or it fuels them with more fear, with more attention, with more of that hypervigilance around, okay, now I've got this disc problem. Then it's like you're labeled by this thing, which is kind of like exists and is like scary, right? On this image. And it's like, shoot, how am I going to fix this? And so a lot of people have good intentions of like getting an x-ray, getting an MRI to figure out what the cause of their pain is. Little do they know, there's almost little to no correlation between what is found and what people feel. And so they get it, and like you get this like temporary high where they're like, okay, I'm good. I'm not special, which is a good thing, because if you were special, then you'd have to reinvent treatment. It would be the first time that somebody's tried something on you anywhere. And so, like you kind of feel like you fit in a little bit more. Like you said, there's a little bit of solitude there. Like, all right, cool. Like this is maybe solvable. But then you realize like it's kind of there's a little bit of emptiness to that, because it's like, okay, well now what do we do? And it's like, well, could do this, we could do this, we could do this. And so appreciate you sharing that. Cool. All right, man. So let's do this, right? Can you paint a picture, if you will, of what life was like, right, at that time, dealing with the back pain, before joining program, as far as how it impacted you, what you were able to do, and then maybe too, I'll take it a step further and like, how is it impacting life in general, even outside of the pain?
Yeah. I mean, to start, because you have this classification of this specific problem, and the internet says don't do X, Y, and Z, you start to be afraid to do certain things. Don't sit this way, don't work out. And I work out regularly.
Yep.
And that actually prevented me from working out. I was a big Peloton rider for a while, and I stopped doing that because I was concerned that I would perpetuate the problem. So I was actually starting to be afraid to do certain things in life,
Yep.
driving long distances in the car. And it actually was causing problems where I was like, nah, I can't do that right there, because it's gonna hurt worse. So it made me afraid to do things that in actuality I can do and do now. But that was the biggest thing. It was this fear cycle for me.
Yep, totally. And so obviously, you were having trouble walking, you were not working out, right? Any other impact, right? And the reason I say this just as a little lead in, right? I know your wife was on the call, right, when we
Yeah.
first started, and so you guys were kind of hashing this out, right? So was it impacting relationship as well as other things? Like pain can do a lot of funky things. So do you mind sharing that? Like, what was the impact otherwise besides just physically?
Yeah, I mean, you become so self-consumed and self-centered, not purposely, but because you're trying to find a cure. And the only thing that matters is how to get that pain to go away.
Yep.
So my relationship with my wife was significantly impacted. Where all I would do is talk about the pain, and I would, I wouldn't do certain things just because I was worried about it, and so it really hurt. It really hindered relationships as well for
Yeah,
me.
yeah. Totally, man. And so what, if I can ask, right, were either you or your wife, again, you were both on the call there. I remember you looking at her, right? She was looking at you. I was looking at you both, right? Were you guys skeptical when it came to moving forward and joining the program? Like what were your thoughts there, and or any like fear, concerns, worries about it?
I wasn't skeptical because I've done so much homework to that point, and I was convinced
Okay.
it was a mind body connection. But my wife was like, I'm like, yeah, I'm going to need X amount of money to do this. And she's like, how's this any different than everything else that you do? It's
Yeah,
like
yeah,
you
yeah.
find something online and like you're quick to chase that down. So it was like, she was skeptical of it just because I was like, all right, I need more. I'm going to spend more money
Yep.
amongst all the other money I spent. And Charlie, I probably spent, up to 50 grand. If I had to throw a number on all these things
Yep. Yep.
throughout the years to try to find some quick fix of some sort. And that
Yeah.
was her perspective. It was like, all right, here we go again with
Yeah.
this.
Yeah, totally, man. Yep, I hear you, man, and very common, right? So how did you get her on board, or did you just say, sorry, babe? What happened there?
Well, I think she realized that I was potentially onto something with the mental thing. So
Hmm.
I think she was willing to accept that. I didn't tell her like I'm going to do this regardless of what you say. I mean, I wanted her buy-in, and
Yeah, yeah.
she was willing to try to see it out. She's very patient like that.
Cool, cool.
She's always supportive, and she's always patient. But like I said, I think she was extremely skeptical, especially when we talked about the price of things.
Yep, yep, totally. Cool. All right, so let's talk about this, man. So you said something really key there. You had tried lots of different things, right? And spent maybe 50K or more, right? Trying to
Yeah.
solve this thing, thinking, hey, this will be the solution, right? It really wasn't, right? And so at the end of the day, like, what are some of those things you tried, right? What are some other things you dropped money on that you were like, hey, I'm going to try this, and then we'll kind of take it to the program, maybe what was a little different. But let's talk about maybe some things you tried in the past.
So it started with physio, right? Like physical therapy. I did that first, and it was a couple times a week. I was doing deep tissue massage to try to get releases of things, and that was a couple times a week.
Yep.
When I was doing that table that I was telling you about earlier, and that was probably $5,000. The table
The
alone.
DRX 9000.
It sounds about right. Do you know about this?
Yeah, I know about this stuff.
Sounds about right. But yeah, I was on that machine for months.
Yep.
I buying the exercise balls, buying the different foam rollers, some with knots, some with not don't have knots. Don't roll below this, don't do that. So I had that. I'm just trying to think of other contraptions I bought. Like I bought like really nice massagers for myself, like from Amazon.
Yep, yep.
And I got these things laying all around the house. I can't really think about. It's been a while.
Do you still have them? Where are they?
What's that?
Where are they? Are they still hanging around the house?
These things all over. Yeah.
Okay.
I have like a shepherd's hook that goes on my back that pulls knots out. Like
Yeah,
I
yeah.
got ones of those sitting in case I needed multiple ones for some reason.
Yeah.
I don't even know how I ended up with two, but I have two. That's every time I open up the closet to grab a hat, I see the shepherd's hook in there. So I'm like, all right, I still leave it in there. Don't know why, but those are some of the things that I bought. Like I said, but the most expensive things before I saw you on YouTube, I ended up seeing another therapist on, like, I was looking at like, and this is usually a common problem with women, was like a pelvic floor dysfunction.
Yeah, yeah, that's right. Yep.
I was like, I think I have the same problem, so I went and saw a pelvic floor specialist for a while. That was expensive.
Yeah, yeah.
So, just driving down to the city every week and, going through all that. So those are just some of the things I can remember. I'm sure there's a ton more that I've done throughout the year.
Totally, man. Cool. All right. So what?
Pain pills is another thing, right? Like I was taking, I was taking benzos and I was taking things like that as well if things were really bad. So.
Yeah, man. Got it. Okay. So you go from this place of just kind of going crazy in the sense of, right, not you, but the pain making you a bit insane, right? Trying all these different things, spending all this money, buying all kinds of different contraptions, going to different places, right? And to your wife, to what she said, right? In all fairness to her, hey, what's this guy going to do different? He can't feel you. He can't. He's just like this next dude, right? So, what would you say was different about this process, right? Because there are going to be people who are watching who are like wondering the same thing. I've already gone to PT. I'm just going to use my insurance. It's cheaper. Death by 1,000 cuts. That's what I call it, right? You hand her the 50 every time, right? Then you look at it and you're like, wow, that was expensive. So what would you say is different kind of about this experience, or was different than just going down the street or some of the other treatments that you spent however much on?
So this approach is different because it included an aspect of like getting to know me on a personal, mental level, like to see where I was with anxieties and like taking it a lot deeper from that aspect. And that's what like I said, like I told you, I was already onto something. And when you first interviewed me, I remember you saying I have to interview. I'm thinking, like, interview for what? Just take my money. And I was just like, you were asking me a bunch of questions about, questions like, maybe some childhood things that happen.
Yep.
And I was like, something's different about this. So that's why I wanted to see it out, because like I said, I already had known before that where you were going with it to some extent. I wasn't fully sure, but that's because you try all these different things. You try the chiro, you try physical therapy, and these things may seem to work for a period of time. And then you go back to having the same exact problem again. You're like, dude, what gives here? Like, why do I keep going back to the same problem? If it was a skeletal structure issue or muscle issue, like it should just be fixed after a couple months or a couple weeks. It shouldn't be coming back. Like I didn't even do anything to re-aggravate it. So that's why I wanted to try that. Because like I said, it was more of like going to the chiro. He gives you a sheet of exercises to do. There's like 10, 15 exercises on there. And you're like rolling around on the ground. You're not sure which one's going to work and which one's not going to work. But you got something working. He's like, which one? I'm like, I have no idea.
Yeah.
Like I did like 15 exercises. So I'm not sure which one it was. So like I said, that's what felt different about you, is you started drilling into more of the mind connection.
Yep. Cool. Okay. So and did we give you like 100 exercises to do? Did I say, hey, here's a sheet of things? No.
You gave a sheet of things that was one at a time. Like try one thing, see how you feel the next day. Try another. It was very descriptive, and it wasn't like just throwing a bunch of poop at the wall and seeing what sticks.
Yeah,
so
totally.
I remember I started early in the process, like trying one-off things one day at a time.
Yep. Testing. Yep. Cool. Yep. So man. So what I hear you saying is that we took a little bit more of a deep dive into the psychology of pain, right, to start. And then we're very systematic about measuring progress, testing things, right? Like one thing, not a million things. So you're not confused and like, well, I feel better, but I don't know why. Or I feel better, or I feel worse. And well, I don't know why. And so we really wanted to dial in on that. Now, there are going to be some people who are watching this, right, who are like, oh, I have a disc problem and I know it's a disc problem and it hurts right here. And so all that mind stuff, it's just a bunch of woo-woo and fluff.
Yeah.
What would your thoughts be?
Well, I can understand that process, because someone may say, like the majority of people you tell about that have major back pain, that it's been like, it's chronic, right? And they're like, all right, well, why is this chronic? You start asking them like, hey, and I would say to many people, because after I got help through your program, I was still doing well a year later. I would tell people like, hey, would you be open to the process or thought that this is potentially somewhat related mentally? And I would specify, like, hey, I'm not saying this is in your head, this pain. It's very real pain. Like it's measurable pain. So I don't think most people want to hear it, Charlie. I think that most people will say, hey, you think it's in your head, but it's not. I think that's the challenge that most people have with that whole thing. And until you're open to explore, those mental things, you may have a hard challenge recovering. I mean, if you're going to therapy all the time, you're going into chiropractic care for years and years and years, and you feel like you're not making progress, I mean, I think it's time to look at something else.
Mm-hmm. Yeah. So this is good, right? And I have the same experience, right?
I remember you told me that.
Yeah. So what do you think it takes for someone to get to that point, right? So there are gonna be some people watching this who are like, I just had back pain that started the other day, and it may be more structure related. The program is designed to help people. It's about 50-50. People have symptoms that are derivative of the structure of the body and then of the mind. So the physiology and psychology, right? Either way, they're kind of hard to detach because your head's kind of connected to your body, right? So this is why we talk about both things. And we give you, like you said earlier, a way to kind of create your case and make it very clear to you as to what's driving the symptom. Is it mostly the brain, or is it mostly the body, right? Or is there maybe some like uncertainty that we have to work through and do some detective work to really get to the bottom to? So what do you think it takes for someone to get to the point where it's like, okay, maybe I should listen to this guy, or be open to this process?
I mean, I think it's simple. I think you have to be at the end of your rope. I think you have to say to yourself, like, I'm fresh out of options, and I've tried everything that I can think to try.
Yep. What if people would try this stuff on the front end?
I mean, I think it would eliminate the lengthy process of, because if you try it in the front end and it doesn't work, then you're like, all right, this is a real structural problem.
Yep.
Like, let me see if I have to get physical therapy. And I'm not discounting physical therapy or even chiropractors. I still see a chiropractor for, on a biweekly basis just for adjustments, and he does a great job. But I think it would really speed up the time to recovery.
Yeah, but the question is whether or not people would be open to it. Fair.
That's the biggest question.
Yeah. So I think that's really important to highlight, because again, if you're watching this and you're like, hey, I've got this back pain, I've got this butt pain, got this leg pain, like this stuff, maybe you already clicked off the video, right? Because your belief system is very locked into Western medicine. Like, hey, you got this MRI, you've got this problem, and it just sucked you in. And maybe you have that temporary solitude where you're like, this just feels good. Like I feel good. I feel confident. I know it's this thing. And that's like what you walk around on the back of your shirt with as a label. That's okay. But you might want to consider that there's like a bigger picture and a bigger process that you're going to want to consider if you're really going to want to have longer lasting results. If you want short-term stuff, the chiropractic, I used to do only hands-on neck cracking, back cracking. This is what I did, right? You're not that far from me, and you never met me in person. In fact, I don't know, we chatted a few times, right? And so at the end of the day, my goal is really to teach people, right, and help kind of break down some of those barriers. And like you said, I think that was one of the big differences for you, is starting to really address some of those belief systems and what I call like pain paradigm, if you will, like the way that you look at this. Because if you look at it one way, I mean, go ahead, go after trying to solve it that way. But if it's not working, at some point, you got to be like, hey, maybe there's something else, right? Yeah. Which I know that we met you at that time. So
and your program is like, it's not easy to start because you have to compile evidence. Yeah. Like, so we're working through exercises, we're going through sheets, we're putting percentages together of pain. And like, for somebody like me, and again, I'm not speaking for everybody, I'm speaking for myself. I mean, I needed to see this evidence of like, all right, like this is what's going on. And I think that's, your program helped me with that evidence out of the gate. Like, I would say, when I do a certain thing, that this thing seems to bother me, or it was just the actual, the actual Excel sheets and actually working through these exercises that was also very helpful for me.
Yeah. Well, I think the reason I do that, man, and well, you see the power of it, is that, I had a guy call me today, right? He's like, so what exercises are you going to do with me? It's like, oh man, we got a long gap to fill. Where are we going to start? It's a little bit more than just exercise. We'll include the motion part of it. Absolutely. And we start by teaching you ways to move your body and ways to feel safe, the way you sit, the way you move, all that stuff. So it's definitely a movement component heavy on the back end, right? But on the front end, it's doing investigation. Like, you're spending a lot of time, when I say a lot of time, as much time as you need or as little time as you need, right? But we're guiding you right away to like, okay, if you're having trouble sitting, then we need to do boom, 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 boom. And I need to know, if we're going to be scientific about solving this, what makes you feel better? What makes you feel worse? Maybe nothing makes you feel better or worse. And that is a piece of evidence. Yeah. That is a clue. And so we just look at this scientifically, and we spend time helping you know what to study, right? Because you can look on YouTube, but if you don't know what to watch, then it ain't going to work that well. So we teach you exactly and put in front of you exactly what you need to know. So this way you're not running around rampantly consuming information that doesn't help. And then we teach you how to follow a very scientific process, so that upon doing that detective work, like, you're getting something out of it. And that something is clarity. And then once you're clear, boom, then you can head towards the motion. Then you can head towards this. It's like, I don't remember the quote. I'm going to totally just bash it right now. But it's something like, hey, was it Abraham Lincoln? I don't know. Something about the dude who's like, hey, if I had to cut down a tree, he'd spend like 99% of his time sharpening it and 10% cutting. Oh, 10%. That doesn't add up. 1%. Math was not my strong suit, right? But the idea is that, like, everybody wants to get cutting down the tree. Just show me the stretch to do, man. Like, I just got in here. It's been one day. Like, why? Like, where's the stretch? It's like, hey, man, like we could do that, but you do realize that that's just doing what everybody else did. And so, are you willing to potentially change the way you're approaching this, so you can actually like understand what's happening, and then from that understanding, from sharpening that axe, then boom, we can get right to the solution.
Especially men, we're like, dude, just tell me right now what I need to do. Like, give me a list. To your point, like I looked when I first started the program, and I looked and I didn't see like there was some things to do physically, but that wasn't right out of the gate.
Yeah.
So I think I spent most of my time like reading up on on the forums and the Curable app, reading books, reading knowledge, getting information around where pain starts, how it traverses your body. So there wasn't even any working out. And I actually left the program before because I was pain free. I left the program before I did any exercise.
Yep.
Yeah.
What's wrong with you though, man? I'm a physical therapist.
I was like, I felt bad because you put a lot of work together, but I was like, I didn't even need to finish the back half of this, and I never did.
It's all good, man. It's a good problem. Anyway, so yeah, man, I totally get it. But again, and I think you've learned the power of this. Is like, man, if you can spend some time on the front end studying, gaining a little bit of knowledge, so knowledge acquisition, and put some effort there, it'll serve you dividends. Because again, the cool thing that I'm trying to do is give people what they need, right? Tools, knowledge, understanding, and support, so that they don't feel like they have to rely on people all the time, right? And so if you spend some time doing that early on, which we really kind of put an emphasis on, we actually start by what I call healing by subtraction. This idea of like, hey, man, you realize that I know you want to like swing the axe and want to know what to do right away, but don't mistake doing less as like not doing anything. And so you're going to actually spend some time. I'm going to spend some time like learning some of this stuff. Come on. Right. But I think there's a lot of value. And I think you saw that as well. So,
yeah, for me, I was at that point already, like where I feel like I've tried a lot of things, and I was at the point like where I was convinced that my problem. And again, I'm not, for all the people listening, I'm not saying that your problem's not is mental or it's starting upstairs. I'm not saying that, but for me it was. And I knew that. So as soon as I got in your program, I realized like this is exactly what I think that I'm after here.
Yep. Cool. It seems like the most valuable portion of program, right, was understanding the role of pain as it relates to, well, the role of the brain in pain, right? The role of the mind on pain, and sort of the psychology of pain, and how it can fuel like the pain experience. Is that fair?
Yeah.
Yeah. And so did we focus a lot? This is an interesting thing for anybody to hear. Did we focus a lot on getting rid of your pain? So hold on a second. Was the goal to get rid of your pain once we discovered what it was and we built up enough evidence, and you obviously were like, okay, this makes sense, right? Did we focus on getting rid of the pain, or did we focus on helping you change your reaction to the pain?
It was changing my reaction to the pain.
Yeah. What's up with that?
One part of that process, it was horrifying for me, was actually like sitting with this pain and not being negative about it, and just saying, how is this reacting? I forget the process he used for it or what the name of it was, but it's like just sitting there and trying to recognize, all right, what is my leg doing right now? How does it feel? Like, is it like really difficult? Is it hard pain, or is it soft pain? Is it like something like, I'm just really trying to be at ease with it and just saying, all right, I accept that you're here. And then we're just going to live like this. I think that was that was the most horrifying thing for me to start, is because part of my process is the fear, perpetuation of the fear. It's like, I used to get panic attacks, and it was like, because you're afraid of, it's the fear of the fear.
Yeah.
It's crazy, but it's like the same thing here. So I really had a difficult time starting to like just trying to not have a negative connotation on the pain that I had, and trying to observe it.
Yeah, very good. Yeah, totally, man. Right. So everybody, right, wants to fight with their pain, wants to figure it out, wants to run from it, or they want to, like, I don't know, they want to try to, whatever. They're always wrestling with it. Okay. And so one thing that you're saying, which I think anybody else watching this might want to consider, right, is instead of wrestling with it, instead of being fearful, worried, concerned. Now, here's the thing. It's almost impossible not to be, if you don't really know what's causing it. And so that's the first thing we do inside the programs. We help you figure out what the heck is driving this thing. All right. But once you kind of build the evidence for or against, right, this or that, and that's probably topic for another video. But at the end of the day, once you really get confidence and belief and conviction, and okay, this is the root of my pain, then you realize you don't have to be afraid of it. And so one of the things that we, try to help people do is, instead of using massage devices and the shepherd's hook and the chiro and whatever to try to fight off these sensations, if you realize that pain is a danger signal, so is fear and so is worry and so is concern and all these things, by using those things, you actually feel the pain more. You preoccupy yourself more with the pain because you're just fueling it with more fear and attention and trying to figure it out, and you're trying to fight it off. And well, you don't fight things off that you're okay with. Now you might say, I'm not okay with this pain. I get it, right? And so we don't always have to. In some cases we do, but we don't always have to try to change the pain. Instead, the goal becomes to change your reaction to the pain. In this case, it was fear for you. You started to notice some fight or flight response, and we had to down-regulate that system and literally just put in the reps and have you practice that so that we could reduce the fight or flight response to the sensations that you were experiencing, right?
Well, yep. And once I started getting comfortable, that's when the pain started. And I used to, it's funny because I turned from being really fearful of that process to like making little jokes at my sciatica. Like when my back would start going, like, oh, the barking dog, here we go again. And I start making fun of myself. Like, times like and for me, Charlie, it would migrate to different places. It would go from sciatica on the right side, and then it would swing to the left side. I'm like, dude, there's 100% chance it's mental. So dude, just go in the back bedroom, go through the process, and I lay down and I think about it and I start laughing about how ridiculous I was being, and then it would stop.
Yeah. Good. So you essentially killed, right, the fear of it by using observation, right, mindfulness. You knew at some point it was safe, right, and then you tied in a little bit of humor. Right. If you can laugh at something, right, it's really difficult to be, I guess you could be afraid of something if you laugh at it, but the chances are much lower. Right. And so you started to increase that overall sense of safety. And we're able to not only calm that down, right? I know you still got some of the twitching, so we're still working on that, but even some other symptoms, like even beyond the pain, right? Like what, headaches, I think, right? And maybe you still have some of those, but like you probably applied some similar concepts. Also, I think just general like anxiety, right? Like how were you able to take this and apply it to other areas, if at all?
Yeah, I mean, and I think that started with like back when I was having panic attacks a couple years ago, probably like 5 or 6 years ago, and I read a book, and this guy helped me realize like your body can handle most of these things, right?
Yeah.
Like even like the panic attack, if your heart starts racing, that's the scariest thing, right? Your heart goes and like, but if you think about it, there's marathon runners that run for hours with their heart rate like that.
Yeah.
I did it for a few minutes and I was able to walk off the ledge on that whole thing. But I think it helped me. Like I always knew that if I could just work at the anxiety, that things would be different, and try not to fear it. Now I still have problems now, like where I'll get a random pain somewhere, and my first reaction is out of fear.
Yep.
And then it takes me some time to say, all right, let's go through the process here, because it's not. I wish I would say that it disappeared overnight like everything, but I've been given the coping tools to work through these things.
Yep. If they pop up.
Yep. And as they pop up, I say, all right, what is this here? And then I start working through the process again. And it's just much easier. And even with the anxiety, like, all right, this isn't as bad as you're making it out to be in your mind. Like, it's not the end of the world.
Cool. Yeah. So again, we didn't treat the pain, but Charlie, that's why I'm calling you. Okay. We treated the reaction to pain, the anxiety, the fear, the worry, concern, the other bells and whistles going off around the sensations that you were experiencing. Once those go away, at least in Mike's case, again, maybe not for you watching, and that's okay. Again, the program is designed to kind of classify right away, what are we dealing with, all right? And then from there, we can go down, kind of choose your own adventure within it. But once those things fade, the sensations fade, right? And it's gone. So, all right, cool, man. Hey, this has been awesome, dude. So like, what would be your recommendation to anybody who's sort of like maybe watching this or on the fence, like, hey, man, I just tried so much stuff. Like, I can't actually believe this dude who's sometimes wears a spinny hat or flannels or, whatever. I don't think he could help, right? What would be your kind of, what would you say to someone like that?
Well, I mean, I'm living proof that Charlie did help me. And like I said, and I've been through many years of chiropractic care, and I keep beating the dead horse to death, but I no longer have to get care anymore. That's just, I'll leave it at that. And like I said, your willingness to work with people, and another thing I would say was not being judgmental on your pain, and not being try to be a little open-minded on the program. Because, I'm sure there's a lot of people like me that are very negative. Something I continue to work on, but like the first time I hear something like, that's ridiculous, that's not going to work. But my point is to be open-minded. that's all I can say is just be open-minded and don't be judgmental as much as you can, and try not to be negative about the process. Like I said, I'm not in the program anymore. I'll leave it at that. And I'm fully working out every day, sleeping great every night, you know, where I wasn't sleeping great before because pain would wake me up all throughout the night. And I'm not afraid to do certain exercises. Whatever I do, I do. And if I feel pain, I just tell myself, you know, this is nonsense.
Yeah.
You know, that you're dealing with this, and I just push through it, and it never stays. Now, I'd say one downside about this is, like, if I actually got a real injury, I'd think to myself, like, all right, this is nonsense, and maybe it's not. But in those situations, which are very, you know, few and far in between, that actually happens. But that's my advice. It's like, just be open-minded, and we're full of skepticism. We're like, how can this work if nothing else has worked? And I think, you know, your body has a way of, or your brain has a way of trying to diffuse things that happened in your past, or diffuse things of, you know, trying to take your mind off of stressful events that happen at work or at home. And your mind thinks it's protecting you, and therefore you end up with pain. And then all of a sudden your mind's off that event. You're like, why is my back killing me right now?
Yeah.
That's the reason. In general, that's my advice. If it was coherent and I wasn't rambling too much.
It's all good, man. No, well, I think what I'm trying to get at, right, is that there's lots of people we can help, right? But you know, if you can't get anybody to believe that there's a different way to solve this, maybe because they're not at the end of their rope, right? Then you can't help them, right? And so it's always useful to have just some insights from people like you who have been through it. You know, it's like, hey, what if this doesn't work for me? It's the number one question we get, right? Probably. And so do you feel there's any way that someone could go through the program, best of the mind and what's out there, the best of the body and movement and testing and being scientific versus a sheet of exercise type of thing, and having all the support tools, resources, and kind of boom, boom, boom? Do you feel there's any way someone could go through the program and not get value and just be like, man, this thing sucked?
No. There's too much science in this program. There's too much neurological advice or evidence around things. There's too much evidence for this to be nonsense, for you to walk away at the end and say, I got absolutely nothing. That's not, in my opinion, that won't happen. I mean, maybe there's 1% of people or 2% that have a situation that's whatever it is, but I highly doubt you will walk out of here and say to yourself, I don't know why I just spent that money. I doubt it. That's my point. There's too much science, and I'm into the science. Like, I want to know, like, why this is a problem, and this program is surrounded in scientific evidence. Yeah. So for me, that's enough for me.
Cool, man. Awesome, dude. Anything else, man, you want to share about your story with folks watching? You don't have to. I just figure I'll give you a final little loop if you have anything else that might be valuable.
Yeah, I mean, it's a process. It's not like, you know, your pain gets significantly better. Some days it's still there, but it's you don't have to fear it anymore, because you know that your body's, you know, God's given us a body that can heal itself. And, you know, if you've had this problem for months and years, you got to say, all right, this is chronic. Like, I can't find any evidence on the MRI. There's no evidence on the X-ray that this is anything. You have to say to yourself, all right, let's visit this thing from the mind perspective. There's a lot of new science that shows about a mind-body connection and neurological issues. Like, you know, you had a rough childhood, you're in a rough relationship, like the job's going terrible, your family's giving you issues. There's a lot of evidence around 2-3 weeks, you develop a habit, and it can be a bad habit, and you developed it. But it's the same thing with a good habit. 2 to 3 weeks in developing, you know, and you start out negative, but the more you go through the repetitions and you start to say, all right, it's like going to the gym. When somebody decides to go to the gym for the first time, they hate doing it. It's like, I don't want to do this. Like, but the more you do it, the more it becomes a routine, and the more it becomes a habit. And it's the same thing. It's the same thing here. Like, so stick with it. Know that you may have pain at different parts of your body, that it's not going to last. Yep. You know it when you're feeling like, yeah, this is fine. It's very, very inconvenient right now, but I know it's not staying. And that's what worked for me. Like, all right, you're just gonna deal with this uncomfortableness for X amount of time. But the second you start to chase that fear down, the worse. The more you feed that monster, the bigger it gets. Yep. And that's difficult sometimes. It's even like sleeping. Some people have, and I've had this in the past. Like, you have issues with sleep, and you have a couple bad nights, and you say to yourself, man, like, you're feeding this sleep monster. You're like, I don't know if I'm going to ever start sleeping again the right way. You know, and the more you feed that mentally, the more real it becomes. Yeah. Like, you know, that's the thing. So it's like, all right. So with sleep now, if I have a couple bad nights, I say, I'm going to recover. I mean, it's unfortunate I'll be tired for a day or two, but I'm going to recover, and I recover every time. And it's the
Yeah.
same thing with me. Like it just goes away. I wish I could say that I don't have pain anymore, but I'm 46 years old.
Yeah.
And so that's part of life. But again, just cutting the fear from this whole entire process, it's the biggest help that you could come by, in my opinion.
Yeah. Of all the treatments you try, man, would you say this type of approach is been more valuable than almost anything?
Yeah, I mean, it's the scientific evidence. It's being open minded that your pain, your brain has, your pain comes from your brain. If you bump your knee in the car door, your brain sends a signal to your knee saying, "All right, we got to protect this thing." So it all starts upstairs.
Yep.
It's like if you can, if you allow it to be a problem, and that's what's different about here. It's the support of the people in the message boards. It's Charlie's support. Everyone's always responsive. There's people that have the same problem. We've helped each other through, and there was a couple people like Laura that I still remember.
Yeah.
Extremely helpful. Tracy was extremely helpful, and I still remember their names a year later because they were very helpful and very responsive. And just knowing there's a supportive community around you that has the same problem, and there's a lot of people like me that are much better at this point in time. So you have the support tools in place in Charlie's program. You have the science in Charlie's program. And even if Charlie decides he wants to put you on an exercise, he's here. He always took my instant messages. If you were always very responsive, and that was a very big help. Like, all right, you have a community here of people that was huge. So all these things, again, and this is the reason why I would recommend your program to anybody that's had chronic pain that has evidence that that it's they can't find it at the doctor's office. They don't know what the problem is. I think this is a no-brainer for anyone in that situation.
Awesome, dude. Well, hey, man, I don't want to take up any more time. I just wanted to have you share your story. I know you're going to inspire lots of people, so I do appreciate it. And yeah, man, let's keep in touch and just know too, again, we don't take away access. So,
time to time.
Good, man. Yeah. So yeah, again, you don't have to, but sometimes seeing some people come back in to give a little comment or, here or there is always cool. So that's it, guys. Again, this was Mike from not too far away, dealt with pain for while, and was able to, I don't know, after spending a lot of time and energy and money with some other places, was able to finally find it, the solution, even though he was at the end of his rope, he still had not given up on it. So thanks to you, man, and thanks to your wife too for trusting us enough to have you move forward. Because again, there are going to be lots of people watching us say, well, hey, I got to talk to my wife, and that might be the thing that prevents it. All right. And so I get it. I totally makes sense. But here to help. If anybody is curious about just learning a little bit more about the process that we use to help people, there's probably a link that you can click above. Just kind of walks you through via like a free online workshop, sort of, the way that we go about approaching this a little differently, some tips, tricks, and again, just a different way to look at it. Go ahead, click that. You can register, and I'll give you immediate access to that. Okay. So thanks so much, Mike. And let me know if you need anything. Otherwise, appreciate you doing this, buddy.
Thanks, Dr. Charlie. Appreciate it.
Take care, buddy. See you.